What you want to look for is any ulcers, skin ulcers around the nipple, ganyo or anything.
Okay.
And also you press the nipple and see.
That one is painful.
You're checking to see if you're going to see something.
Okay. If something will come out and
what
stuff
do you
like
think
that.
would come out and you suspect cancer? What?
Imagine.
Just imagine. What do you think?
Yeah, you don't have kids or nothing. Just maybe something is coming.
Okay, if for somebody that has never been pregnant and has never breastfed before, you're not supposed to see milk.
Imagine. What do you even say at that point?
Some people don't have babies, but they maybe had one pregnancy that they lost.
Yeah.
So usually the body already starts preparing for breastfeeding. So that would not necessarily count. I had a patient once who came like, oh, madam, like so worried. I'm like, but I had to sit down and take a moment. And it was later I realized, have you been pregnant before? And then she said, yes. I'm like, okay.
You almost got me.
Yeah, right.
Don't leave out these information. They're very vital.
And I wanted to know, what are the warning signs that should never be ignored?
A breast lump is the most common. And then you shouldn't see blood in the nipples, whether you're from the nipples, whether you're breastfeeding or not. You should not see
That'd be
blood.
crazy.
Blood in the nipple discharge is one of the...
Do you feel like pains or anything?
Yeah, usually the pain comes when it's advanced. So the lump would pain in advanced stages.
By that time, you're like,
that's
I'm dead. Make your
when they
arrangements.
usually come to the hospital when it starts getting bad or the skin has an ulcer now. Because imagine, like, this is the breast and then there's this lump here that's growing. Lump, growing. They're growing in all sides. Yeah. And then they will eventually come to the skin. So if they come to the skin, they're still growing. What do you think will happen? The skin would open up and then sometimes they have skin ulcers
and stuff like that.
Like a wound on the breast.
I don't know how y'all do it. Honestly, mad respect to you doctors, because me, first day I'm fainting
so,
like this.
No.
About the lump growing and coming in or out of the skin, does it apply to men as well?
A man with a breast lump is more urgent than a female with a breast lump.
Because I feel like theirs will show more quickly because they don't have all these things.
But again, you know what I'm thinking? You know the men that be
the
jacked.
chest.
It's hard to
How
tell.
is it? Yeah,
how would you even tell with those men that are already got like C cups already? Sorry.
Yeah, so when a man has a breast lump and a woman has a breast lump, a woman usually, it's full.
Yeah.
So the lump has a lot of room to grow first before it goes out.
Okay.
But the man doesn't usually
have that.
So when they have that lump, usually they are more shy to come and say, I have something in
I beg, you are
so
dying. Don't be shy. Go and get him.
So
something that has not been part of you, all of a sudden is showing and you say you're shy.
You have to go. You people, men, I beg you.
Please.
If you see something is going on, it's not go. It's more urgent to us. At least some people can waste small time before they. But you men,
yeah. So a woman would have more time for it to grow in the breast. But when you put 100 women that have breast cancer, 100 patients, only one man would have breast cancer.
So it's not like really
it's mainly a woman thing. So it's 1 in 1,000 men.
Yeah. Men, go and screen and test yourself.
Just because they say 1 in 1,000 men doesn't mean that you should not be screening.
You know what I'm just. You
should be doing this too as well. You know,
exactly. You know what I'm saying?
You should.
Because you know what would be crazy? Once you die from that, God forbid, but as a man, let's say you have or whatever, what are you going to put on your headboard, on the tombstone? Or he was too shy.
Because of breast cancer.
He was shy to go and get tested. Preventable death, though, to go check. Here lies the man that was too shy to go and, sorry, that'd be
okay,
messed
up. So I think a lot of things that happen to us as humans, it's usually normal. And it's just the body showing you that it is functional at some point and it's not functional. Yeah. So this question I'm asking, it's with regards to treatments or operations with...
I was literally about to even go into that. Correct. Let's segue.
So, sometimes, even with fibroids, sometimes when they have like operations, it comes back again. So does the same process happen with breast cancer? Like once there is a successful operation, is there any chances of it occurring again? Looking at it.
She's thinking, how's she gonna let us know?
Yeah. So it
That's
can
crazy.
reoccur. If you have breast cancer, you're likely to get it again. You're more likely to get it again than someone that has never had breast cancer.
Oh, shit.
Badass. Not bad. It's not good.
So the thing is, it's 1 in 8 women. In a lifetime, let's say you put 8, how many women are in this room?
1, 2, 3, 4, 5. It's 2, 4, 6. 6 of us.
So you need 2 more for one.
One.
Statistically, obviously, statistically, it doesn't mean that any, but statistically, like you have 1 out of 8 that would be diagnosed in her lifetime. Like this is not the end of our lifetime. Let's say we're on average we're age, let's say 30. And then some are going to go to 90, some are going to go, that's your whole lifetime. So during the lifetime of a woman, 1 out of 8 women would be diagnosed.
Okay. So can you give us an overview of how it would be treated here in the Gambia?
Yeah. So what we do have at least the first, you can diagnose it here. You can start treatment here. You can do the surgeries here.
Okay.
Especially if it's early.
If it's early.
Easier.
Yeah. That's
so
true.
the breast cancer is a whole group of cancers too. There are different types of breast cancer. Depending on the type, that would inform the type of treatment you're going to receive as well. Yeah, but generally you do surgery, you do chemotherapy, you do radio. We don't do radio, but we can do chemo here, and then we can do surgeries. Especially surgery.
The surgery,
that part is good.
We got surgeons here.
They're doing well. Actually doing well.
Yeah. So okay. I wanted to know what are the side effects that patients should expect and how could they manage them with the treatment and things like that.
Okay. So that's the whole point of the advocacy. We want women to come early so that we can detect it early, so that the treatment can be a bit easier. Yes, because how you would treat someone that has maybe stage 1 breast cancer and another person with stage 4, it's not the same.
Stage 4 is the highest one, right?
Yes.
Wow.
So stage 4 is when it has metastasized, meaning it has gone to some other organs that are not the breast.
So what are the names of the stages?
Yeah, 1, 2, 3, 4.
They're just 1, 2, 3, 4. You just tell them,
it tells you the level it is at.
How severe it is.
So if it's stage 4, that is metastasis, meaning it has left the breast, traveled through the blood or the lymph, and gone to the brain, or the liver, or the bone, or the lungs.
So what does it do to the body when it goes to that stage?
Yeah, so imagine like you have a lump in a breast, and all of a sudden that same cancer cells. It's not like the lump moves. No.
Whoa, wouldn't that be crazy? Today you wake up, it's on your breast. Tomorrow it's on your back.
What's going on? Like, I know.
That'd be great. See.
Yeah, so it's like you have a group, and then some family members who
are leaving. They say no, we want to explore the body. And you then check other side of the
That's crazy. So it goes into like your
like through the lymph or the blood. It can go and seed in another organ. So if it's the brain, you cannot start saying, okay, I'm going to do breast surgery and maybe remove your breast and then remove the breast. You can't. It can't work that way.
So imagine, not only is breast cancer, you can also
Cancer
have other
is
cancer
indeed
like
Yes.
cancerous.
I agree.
Now that you said it, bro, with all the explanation,
No, I
all
didn't
that I
realize
know,
it could go that far.
I'm about to be checking myself every
day.
That's the whole point of the advocacy. So women can come early. If they come early, you just do a lumpectomy and remove the lump and leave the breast. Yeah, and then they can do chemo and somewhat radiotherapy sometimes. But if you come late, and it has gone to the other parts of the body, you still lose the breast, and then you will not still get cure. So that's the problem. Because
with the advocacy side, like how is it going on? Like, have you guys seen improvement? Are the ladies coming in early, like to come and check, or is it like still with the struggle of them having to wait until it's like on stage 4 and then they start coming in?
So the last time we checked was the statistics was last year. You had an average of stage 3 and 4, and that was like the average stage 3. Yes. So stage 3 is when distal nearby organs, when it's touching maybe the lymph nodes, and that's part of the self breast examination. You have to raise your hand. I saw that you were raising your hand.
This year we are raising the hand.
This one, she shook it.
This year we are raising the hand. Let's raise it together, man. We got to do something.
Have to. Oh my goodness.
So when you raise your hand, this hand, let's say the right hand, should examine the
left breast.
Yes. the left breast, and then don't forget the armpits, because that's
goes
the
up
first
here.
place the lump is going to likely go to.
Me,
if
I'll
it's
be
leaving the
having
breast.
flare-ups because I have this condition that's like, I forgot, it's HS. It was like one of my friends that diagnosed it, one of my nurse friends. Shout out to you. So, so now when I have a lump like this, hey, God, you people.
Yeah, so it's just to make sure that you don't forget that part of, you need to check on the armpit and
Armpits
make
go
sure you're not
down.
palpating any lumps as well.
Hey.
So when these women come in with the stage 3 and 4, like is it like emergency treatment? Like how fast? Because stage 4 one is
Yeah. So even with stage 4, you can still get some treatment, and some women, like, the response is not the same. A woman can respond very well to chemotherapy, and the cells are they're literally listening to the chemotherapy and trying to curtail their movement. So you can have someone come to in stage 4 and still be relatively okay. You can have someone in stage 3 or 2, and then, it's not responding too well. So it's a whole group of diseases. But obviously, you cannot count on being lucky in stage 4. That's why the earlier you come, the better it is.
So when you say like when they don't respond to like treatment, how does that look like?
Yeah, sometimes they change the therapy depending on what, again, because the types of cancer, like I said, it's different. It can be hormone positive or not, and there's a whole classification on the types and which treatment best works for them. So when it doesn't work, sometimes they can change the treatment and try something else. But honestly, we don't want women to go through those things, because you started, I think the question was on side effects.
The side effects, yes.
Chemotherapy, they're very powerful drugs. Usually they're not selective. They're not going to go into the body and be like, I'm going to the breast only. I wish they were doing
Isn't that why
that.
like people's hair be falling out?
Yes.
Oh, God.
So it affects all, if not all, most fast-growing cells. So what are the fast-growing cells in your body? It's the hair follicles.
The hair follicles, yeah, that's true.
Supposed to be fast, but I don't know what is happening.
on my side is
My
not fast.
side, we just thank God for the locks, because if not, you people, my hair will be here.
My own is just okay, man.
It's
just doing his
wow.
job.
So that makes sense though, like,
Now
because you know how like in the
so-
movies you be seeing like, oh, I just started chemotherapy, and then you're
They're
seeing the
pulling
hair,
pulling hair,
they're pulling the hair, so
right.
they have the scarf. I did
yeah.
not realize that.
So it's the hair. Most people
Yeah.
go bald, like bald.
So they were just shaving their head like this
Because,
once they get
a
diagnosed.
chunk has
left already. So
the
might as well.
reason why some shave before it gets there is because at least you feel like you're in control. You're the one cutting
having
your
to-
hair.
yeah.
Imagine you're doing washing and then one chunk that can just
shouting.
pull your heart out. That's difficult.
That will traumatize you too.
That is
would.
difficult.
You will put your
Because I
brain
feel like
on
it's like a physical reminder, like, yo,
Right.
I'm going through,
Right.
you know?
And women, we love our hair, we love our skin. And those are the things that it goes after, your nails.
Oh Lord.
So the nails will get dark and
bet.
you can get infections under your nails as well. Yeah.
That's crazy.
So the skin can change as well because it's a fast growing cell. And the
Yeah.
other thing is the gut. So diarrheas are common, or pain,
So
terminal
not
pain.
only are you
Like
going
lack of
through the
appetite, 'cause
cancer,
I feel like most of the time they are
the
very
nausea
like skinny.
is the nausea. Yes.
so not only are you going through this cancer,
The
so the
chemotherapy
treatment is
hard.
what is making you go through some more
Yes, the
things.
chemotherapy. It's not the cancer that takes your hair off.
No, I'm saying like, you're already dealing with like the
cancer itself.
The cancer
Now-
itself,
the
like
trauma
wow,
of
the
the
trauma of actually being,
diagnosis. Yes.
and then now you're doing the treatment.
Yeah. So
It's a whole nother ball game.
it is difficult. That's why the support is important. That's why we don't cry in breast October. We celebrate because we know that women need that support to feel like they're still part of that community, and there's a community out there to support them. We wear pink, we have fun, we are saying celebrating breast cancer.
Yeah.
There is no other illness we are doing that for. We're not celebrating malaria.
That's that one, mom.
That's right.
So we wear pink, we have fun, we try to make sure that
Raise awareness, do fundraising, things like that.
So after like the chemotherapy and stuff, like do you like get back all these things? Like if you start taking, maybe like supplements and something, maybe get the hair back, nails, skin, maybe try to look confident again.
Yes, your skin would come back gradually. Some people go dark, like your skin color. You're brown right now. Literally, you can be
The ones that
understand.
hate dark skin,
So
that
my-
one they would be crying.
The way I'm pissed when I'm using like a soap, and the next minute I'm seeing like my face is giving me, different colors, one people. Hey, the way so imagine if you have to go through that, you're seeing yourself in like it's like
you don't
in
recognize
another
yourself.
body, basically.
Exactly, you
It's
can't
like, who
recognize
is this?
yourself.
But that alone is
so with the
traumatic
nausea and stuff, is
experience.
that why people be losing like so much
Yeah,
weight
the weight
and stuff?
has a lot of combinations
Yeah.
because, like I said, you're losing the gut is also shedding a lot. You're having diarrhea, you're having nausea, you're not eating well. So there's the weight loss is just a combination of a lot of stress. You're going through stress, and then those drugs, like I said, they're not having mercy on you. Yeah, so
these women are strong.